Have you ever felt pain in a limb that is no longer there? This video will finally explain why it happens and how you can stop it fast. So let's start by looking at what phantom sensation is. Now the sensation of presence of the amputated part of the body is what we call phantom sensation, which means that you feel the presence of the part of the body that was amputated surgically, the part that was removed surgically. That is what is known as phantom sensation, the sensation of presence of the amputated part of the body. Then the first sensation to appear usually is to scratch the chin with the absent hand. So let's say, for example, my right hand here was amputated. Now the first sensation that I will feel will be to scratch my chin using this hand, even though it has already been amputated. Then another sensation to appear will be to walk on a missing leg. So this is where your leg has been amputated, but then you feel you should walk using that leg. It is a sensation which doesn't really recognize that the part of the body has already been amputated. Now those two are the first sensations to appear. The first one is to scratch the chin with the absent hand after amputation, and also to walk on a missing leg. Phantom sensation is, however, absent in certain cases or conditions. Number one, we have congenital limb deficiencies. So in those who are born without limbs or with the short limbs, that is what we call congenital limb deficiencies. So they never feel the phantom sensation. Then amputation before 4 years. So if your body part was amputated before you reached 4 years, you will never feel phantom sensation. Then patients with brain damage. Now the explanation of phantom sensation, as we will see, originates from the brain. So if you have brain damage, you will not feel the phantom sensation. Then amputation of the anesthetic limbs. Anesthetic limbs, these are limbs where you no longer feel the sensation. So those are the 4 cases where you never feel the phantom sensation. Now phantom sensation is explained by various theories of neuroprojection, like the ablation of the cortical representation. Now what this means is that all the body parts have a representation in the cortical region of the brain, in the somatosensory cortex of the brain. For example, the right part of the body is usually represented in the cortex on the left side of the body. Then the left side of the body is represented in the cortical region of the right side of the body. So the perceptions that are remembered by the cortex is said to produce the phantom sensation. Now the cortex usually fires even after amputation, and that is what is said to produce what is known as the phantom sensation. And this also explains the reason why the deformity and problems before amputation will continue as phantom sensation. The brain already has the map, and it continues to fire its sensation to the regions. Then the sensation tends to disappear with the duration of time. Then the last sensation to disappear is sensation from the missing thumb or the great toe. So usually this sensation will disappear with the time, and the last one to disappear with that will be that of the thumb in the upper limbs and that of the great toe in the lower limbs. So that is what explains the phantom sensation. Basically, it originates from the representation of the body parts within the cortical, within the cerebral cortex, within the somatosensory area, which has a picture of the body parts, and it continues to fire even after amputation is done. And that is why you will find patients, after they have undergone amputation, they still feel the missing limbs because the brain still continues to fire. Then let's now look at phantom pain. This is a painful, disagreeable sensation with strong paresthesia in the absent limb. So this usually occurs in the absent limb, the amputated part. It is usually painful sensation with strong paresthesia in the absent limb. So paresthesia basically means pins and needles, whereby you feel the pins and needles sensation within the absent limb, the amputated part. This pain may be constant or intermittent, and usually it is precipitated by certain activities. Number one being contact with the painful stump. So if you put pressure or you put contact with the painful stump, you will feel phantom pain. Number two, we have trigger area anywhere in the body. Trigger areas anywhere within the body. Then we have urination, intercourse, or angina. This can precipitate phantom pain, and also emotional reasons. So those are basically the causes or the factors that precipitate phantom pain. I have talked of contact with the painful stump. Then we have trigger areas anywhere in the body. Then urination or intercourse or angina. Then we have emotional reasons. So those are the factors that precipitate phantom pain. Let us now look at the types of phantom pain. Number one, we have cramping pain, like that of muscle spasm. So muscle spasm is basically the involuntary muscle contraction that occurs. So number one type of phantom pain is that of cramping pain, like in muscle spasm. Then number two is electric shock like pain that lasts for a few seconds and is episodic. Then number three is the burning pain that is felt throughout the stump and the phantom limb. You feel a burning pain. Then number four is the squeezing pain. So those are basically the types of phantom pain. So let's look at the management of this pain and the phantom sensation. So for the phantom sensation and phantom pain, the best way that science has shown it is best relieved is by the use of mirror box. The use of mirror box in what we call mirror therapy. Now this basically whereby you place a mirror box in front of the patients, then they place the sound limb. The sound limb is the limb that is not amputated, and also the limb that was amputated within the mirror box. Then with that, they can be able to visualize the sound limb, which is reflected in the mirror on the opposite side, and then both sides will now appear sound. Now this visual recognition of the movement of the sound limb and also movement of the reflection of the sound limbs on the other side, which means that the patient can now visualize both limbs moving, is very important in the relieving of phantom sensation and relieving of phantom pain. Now that is the number one and what is considered to be the best way in the management of phantom pain and phantom sensation. Then what we call the 10-point program in the treatment of phantom pain. Number one, we have preoperative preparation of the patient about phantom sensation, and that it is normal and not harmful. So before surgery is done, the patient should be prepared that they will feel phantom sensation after surgery, and that it is normal and not harmful. Then number two, we have post-operative examination of the stump daily and advised to use the residual limb or stump. Now we talked of a stump. A stump basically is the residual part of the body that remains after amputation. So after surgery, these patients are advised to use the residual parts that remains. They should be able to do the range of motion activities. Then number 3 is normal healing of stump is essential, as infections and complications are more likely to cause the phantom sensation. So what this means is that the stump should be provided with a normal healing environment, and infections should be prevented, and any other complications should also be prevented, as this may cause phantom sensation and phantom pain. Then number 4, massaging the stump and then toughening the skin by gentle pounding without damaging the skin. So basically what this means is that it is usually done in the stump that has already somehow healed well. So you do gentle massage on the stump, and then you can also do gentle pounding. You don't do it vigorously. You do a gentle pounding to prevent damaging the skin, and also it will help in the management of the phantom pain. Then number 5, you exercise the stump muscles with imaginary movements like pedaling in an imaginary bicycle. So this is basically what I explained using the mirror box or the mirror therapy. It provides the visual biofeedback, the visual representation. Whatever the eyes will see will seriously impact the sensation within the brain. Then number 6, you provide prosthesis as soon as possible. So prosthesis is just a replacement of a missing limb, the replacement of the amputated part of the body. It should be provided as soon as possible. However, it is provided usually after stump wrapping has been done with proper stump shaping, and healing is already considered to be good. Then number 7, we have local blocking agents like ethyl chloride spray and local procrein injections. So these are basically blocking agents that block pain within the site of pain. Then number 8, we have physical therapy. Now physical therapy includes a variety of several things. One of them being they do stump wrapping to ensure stump shaping. They do range of motion exercises just to ensure that the limb is able to achieve all the movements in all the directions. Then they also train on balance and support, then proprioceptive activities, and also in the strengthening exercises. Then number 9, we have drugs. Now drugs include things like beta blockers, anticonvulsants, phenytoin, carbamazepines, and many others. Then we have surgical modalities. So these usually are always the last option after all the other options have failed. So number 1, we have what we call anterolateral cordotomy. Then number 2, we have thalamic tracheotomy. Then number 3, we have subcortical neurectomy, ablation of the somatosensory cortex. Then number 4, we have electrical stimulation of the dorsal column of the spinal cord. So that is the 10-point treatment program in the phantom sensation and phantom pain. But the best way to manage phantom pain, as I have said, is by the use of mirror box in what we call mirror box therapy. It provides a very good visual biofeedback to the patient and hence prevents the phantom sensation. So as I said before, phantom sensation is the sensation of the presence of the amputated part of the body. while phantom pain is a painful, disagreeable sensation with a strong paresthesia in absent limb.